Today, exactly 1 year ago, Ebola was declared a public health emergency in Guinea. To mark this, Médecins Sans Frontières, MSF, is releasing a report revealing some of the pressures and tough decisions the organization had to take in the face of one of the deadliest Ebola outbreaks to date. Now, these included efforts from some quarters to downplay the severity of the epidemic. From MSF, we are joined by Dr. Giles van Cutsum. He's a medical coordinator at MSF. It's so good to have you. Thank you very, very much for being with us here on Morning Live.
Thank you very much. I'm very happy to be on the show with you.
Good, thank you. Marking a year to the day since Ebola was declared a health emergency, I suppose let's just come into the present. Has it been brought under control? Is the situation a lot better than it was a year ago?
It is better than it was 6 months ago. It is not by any stretch of the imagination under control. We still had 150 new cases in the week leading up to 15 March, which is still more than any of the previous outbreaks so far, with ongoing transmission in hotspots in Sierra Leone and in several districts of Guinea.
Yeah, so the situation is still very bad. However, it was very interesting to read in the introduction where I said there were efforts from some quarters to downplay the severity of the epidemic. Why? Why was this the case?
I think at the beginning of the epidemic, definitely from the World Health Organization and from the government of Guinea and Sierra Leone, there was a reluctance to recognize the severity of the outbreak. People were accusing MSF of creating panic. You even had accusations that we were exaggerating the epidemic for fundraising. And really took until August, 8th of August, before the World Health Organization finally declared it a public health emergency. By that time, you had already 1,000 cases and the epidemic was completely out of control.
Yeah, yeah. So, I mean, there really was a lot of disagreement between MSF and the World Health Organization to the scale of the outbreak. What were the issues there? Have these all been ironed out now? I mean, obviously, as you say, it did take some time, but is it now sorted? Are you both on the same page?
Definitely. I think now everyone recognizes the scale and the importance of a coordinated international response. So there's no more discussion about that. There's still a need for more regional coordination between the three countries and for more real human resources on the ground. So many people have been trained, but not all of them are on the ground.
Yeah, yeah. What were the biggest challenges in responding to the outbreak? So, well, first of all, when the outbreak was discovered in March, it was already present in 4 different counties in Guinea, including Conakry. I've lost sound. Including Conakry, the capital. So it was for the first time reaching a big city. So one of the big challenges was to be present in many places at the same time. It very quickly stretched our human resources. And then, as there was very little support from the international community during the first months, we were faced to respond to the epidemic by the few private aid organizations and the governments of Guinea, Sierra Leone, and Liberia. So we had to make very difficult choices into where you put your resources, and we focused a lot on isolation and treatment of people, but then couldn't invest as much as necessary in all the other pillars of the response: community mobilization, contact tracing. That was a very difficult challenge, and then there was a terrible challenge for healthcare workers that. In order to admit as many people as possible, we had to lower the standard of care because we just didn't have enough resources to provide a high standard of care to everyone. So we had a choice to make between admitting as many as possible or admitting just a small number. And so that's very hard for healthcare workers in Monrovia, where I was working. In August, they had to close the doors of the treatment center up to 23 hours per day because the center was full all the time.
And it's really tough. I mean, when we get a real perspective as to what was going on. Just finally, was there anything you could have done differently?
Yes. I mean, in retrospect, we think we should have, even within MSF, mobilized more resources outside, because the Ebola expert pool was a relatively small pool at the beginning, because those very few people knew Ebola very well. We had about 40 experts, and at the beginning we tried to work with our expert pool. We probably should have done earlier what we've done later in the epidemic, which is bringing in MSF people from other areas like HIV, TB, and other emergency projects, so that as to increase the number of people we could mobilize, as we are doing now. I mean, now we have 5,000 people on the ground. That could have been done earlier. I don't think we could have cried for help more than what we did. It's definitely a big failure of the international response. The international response could have intervened much, much earlier, and we would have saved thousands of lives if that had happened.
All right, let's leave it there for this morning. Thank you for talking to us, and thank you for the amazing work that MSF always does. The deadly Ebola outbreak, it was a year ago today that it was officially declared a health emergency in Guinea. As you heard, it was a tough decision and a big fight that was happening. But now, although the situation is better, there still is a very, very long road and fight ahead of them. That, of course, was the medical coordinator at MSF, joining us here on the program, Dr. Giles van Katzum.